Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I'm a certified hand therapist, and we are going to be making Forward Therapy channel history today. We are going to talk about the shoulder. So this video is going to be a very nice basic overview of frozen shoulder or adhesive capsulitis. Going to go over some information about what that is, what the symptoms might look like, and some stretches that you can start with. Or if you're a therapist watching this, these are some stretches that you might incorporate into your treatment plan for patients with frozen shoulder. So yeah, it should be really good. I would say, as always, just a disclaimer, please be sure that you have sought out care from a doctor or a medical professional so that they can clear you to do any exercise program. So what is frozen shoulder and what causes it? Frozen shoulder is a shoulder pathology that is hallmarked by significant stiffness and pain. It is something that has to do with the thickening of the shoulder capsule and tightening of the shoulder capsule. So between the joint of our shoulder, the surrounding material is called the capsule of the joint, and that material, that connective tissue, will actually thicken and tighten. What are the causes of this? There are still a lot of things that I think are not understood about what exactly causes this. There are definitely certain risk factors. For instance, people that have diabetes are a little bit more prone to developing frozen shoulder. It's something that can occur without really any logical reason, but it's also something really common that we see in patients that have had fractures of other bones. So something, for example, like a wrist fracture, they're in a sling for a long time or a cast for a long time. They're not doing normal daily activities where they reach for things or use that arm. And so the shoulder is stuck in this position for sometimes 4 to 6 weeks, sometimes even longer. And if they don't practice moving it, a lot of times they will develop a secondary frozen shoulder in addition to their wrist fracture or their other injury. So typically frozen shoulder will begin with pain in the shoulder, and that progressively leads to increased stiffness over time because there is pain with movement. There's a lot of times pain with sleeping. And so it's a very self-limiting diagnosis because if, there's pain with this movement, we tend to guard and not move. And so that leads to just increased stiffness. It is worth noting that it can take several years for it to go away. So it is unfortunately, a very long process to go through. And there's generally 3 different stages that are considered to be the stages of frozen shoulder. So there's the freezing phase, where things are starting to get a little bit worse. The stiffness is starting to come up. Then there is the actual frozen phase, where, things are obviously, like it sounds like, frozen, very stiff. And then there's the thawing phase, where things are starting to get a little bit better. So it's not uncommon for this to take 24 months to completely resolve. So just a little overview there. Again, adhesive capsulitis is literally the thickening, tightening of that shoulder tissue, that connective tissue around the shoulder joint, that leads to significant stiffness. And when assessing a frozen shoulder, or what you suspect might be a frozen shoulder based on the patient's symptoms, it is important to look at everything that you would normally do in a shoulder evaluation. So getting a thorough history is really important. Taking active range of motion measurements, seeing how much the patient can do on their own, but also doing passive range of motion measurements, because with a true frozen shoulder, both will be limited. They will have limited active and passive mobilization. You also want to rule out, other conditions, differential diagnosis. So it is helpful to have had, x-rays, which typically are normal with frozen shoulder, just to make sure that there's not something like a fracture, dislocation, arthritis going on that could be causing the issue. So what are some exercises that you can start with working with your patients, or if you are somebody that is going through frozen shoulder, adhesive capsulitis, what can you start to do about it? Again, this is a self-limiting diagnosis because of the pain. So try to do the best that you can. Make sure that you stretch frequently throughout the day, and you do have to push to that discomfort level to make sure that you're stretching those tissues out. So the first exercise that I want to show you is called shoulder pendulums. And I'm going to use my bed as a surface, but it's really best if you can use, like a countertop or a table, something like that. But essentially you want to create a little bit of a brace for yourself, and then you want to lean over at your hip level, letting your arm hang down. You're going to create a shoulder pendulum movement by creating movement of your body and allowing your arm to relax. So this usually feels pretty good for people with shoulder pain because they're not moving the shoulder. They're actually just swaying their body and letting the arm go along with them. So you can create kind of a circular pattern, just depending on how you rock back and forth, you're gonna get that nice shoulder movement. And it's nice to do that, again, probably 3 times a day, maybe even more if you're able to, at least 10 repetitions. Like I would say, try to do this for like 3 to 5 minutes, as much as you can, just to get that nice shoulder motion. So our next exercise is going to be a chop lift. It's an active assistive position. So I'm going to lay down on the floor to demonstrate that position. I like to have my knees supported just to help take pressure off my low back. And then you're going to use your unaffected arm, which is going to be my left arm, and you're going to clasp fingers together with your affected arm. And then you're going to use your left arm to lift the arms out straight in front of you. My right arm is going to stay relaxed. And I'm just going to start bringing my hands over my head, taking them as far as I can to the point where I feel a stretch. And then I'm going to hold that there. And then bringing it back down. Again, you do want to find that point where it's a little bit uncomfortable, where it's a bit of a stretch. And over time, you should be able to get a little further until the arms go all the way back. So that's going to be an example of your chop lift. So the next exercise, you're going to need either a cane, a broom, maybe an umbrella, something like that you can use to give you an assistance into external rotation. So again, you're going to lay down for this exercise. Let me give a minute to just get into position, and then I will show you what this looks like. Okay, so I'm using my left arm as my affected arm. So I'm just going to hold on to the end of the broom here, and I'm going to keep my arms down at my side, especially with your left elbow. The affected elbow should tuck in at your side. And then you're going to use your unaffected arm to push on that broom. And as I do that, it rotates my shoulder outwards. So it pushes my arm out to the side. You're going to find that uncomfortable range. And then again, hold there. Okay, and then for the last exercise that I want to show you today, this is going to be a stretch into internal rotation. And before we start getting into pure internal rotation, you want to start having people work on getting across their body. So more of an adduction internal rotation type of stretch. Because if they can't do that, they're not going to be able to do pure internal rotation. So you do need a small towel for this exercise, just to prevent impingement from occurring. So you're going to tuck that right underneath your arm and your chest, so kind of right under the armpit there. And then you want to bring your arm across to touch the opposite arm as much as you can. And then you can start to crawl your way up the arm, or if you start on your body and your chest, you can kind of start to crawl with your fingers over to the other side to start to get that nice stretch. So that's going to be your cross body stretch. Again, you're just going as far as you can, holding, and then relaxing. So all of those exercises, it is important to do them multiple times throughout the day. I usually recommend at least 3 times a day, try and move as much as you possibly can, even if it's just, you know, a moment here or there where you can get over and do a little bit of pendulum action or some assisted flexion exercises so that you can stop letting that stiffness really just persist as long. So again, this is going to take a long time to get better, but these things will definitely help over time. And I hope that all of you watching today have enjoyed this video. Hopefully it's been helpful in some way. Definitely not an all-inclusive list of exercises or progression, but just something to get you started. So thank you guys so much for watching. I hope that this has been helpful. Subscribe if you are interested in continuing to follow the channel, and give it a thumbs up if you liked it.